Hello everyone, once again I welcome to my series of lecture, that is Understanding Pharmaceutical Science with Dr. Hariharan. So today we are going to discuss about the production of diphtheria antitoxin. So in this lecture I have elaborately discussed about how the production of diphtheria antitoxin is done. So before getting inside the production of diphtheria antitoxin, first we understand what is meant by an antitoxin. So antitoxin is an immunological preparation, otherwise we can also called as antitoxic sera. So it is generally an antibodies preparation. If you see that certain bacteria, especially bacteria like diphtheria and the tetanus, that is Clostridium tetani and the diphtheria bacteria, the organism itself is not infectious to the persons, whereas the toxin, that is the exotoxin released by this bacteria, is generally infectious in nature and it causes the major disease symptoms to us. So to avoid this one, to inhibit this exotoxin, the body usually produces an antibodies. In certain conditions, if the infection is so vigorous that we have to supply these antibodies from outside as an passive immunization. So at that time, this diphtheria antitoxin has its roles. That means especially the antitoxin has its roles. So antitoxins are generally an immunological preparation which is generally antibodies, which is an antibody containing preparation. So these antibodies is generally obtained from the serum of an immunized animals, so which is generally having an antitoxic, antibacterial and antiviral characteristics. So this antitoxin preparation are generally administered once there is a need of a passive immunization is needed. So in the most cases, the diphtheria is the most common infectious agent. So we have discussing about the production of diphtheria antitoxin in this lecture. So if you see the production of diphtheria antitoxin, it includes several steps. So if you see the following steps which is needed for the preparation of diphtheria antitoxin, the first step is the selection of animal. So we have to select a proper animal in which we can get a maximum amount of antibodies. So generally the preferred animal is the horse. So after the selection of animal, the second step is the isolation and quarantine of the animal, just to make assured that the animal doesn't get infected with other diseases. And the third step is the immunize the animal with the toxin or the toxoid, so that it has an ability to produce the antibodies. So once the animal produces the antibodies, the fourth step we will collect the blood. So in the blood, the serum part carries the antibodies. So after collecting the blood, and the fifth step, we process the blood. That means we remove the blood cells and we get the serum in an pure form. So after getting serum, still we refine it to remove the clotting factors, and finally we isolate the antitoxin that has been administered as a dosage form. So these are the basic production step of an diphtheria antitoxin. So if you see the steps one by one, the first one is the selection of the animal. So the most preferred animal for the production of diphtheria antitoxin is the horse. So why the horse is preferred is that it is a considerably a big animal. So we have a chance to collect enough quantity of blood after immunization, so without causing any harm to the animal, and moreover it is easy to handle. So because of its size, it is easy to handle, and moreover it is a domestic animal. So it also helps to simplify administration into the neck muscle and withdrawing the blood also. So the final one, if you see the red blood cells, the RBCs of the horse settles very faster enough, and we get a clear serum when compared to other animals. So this facilitates the separation of the serum and further processing also. So that's why we prefer horse as an animal for the source for the production of diphtheria antitoxin. So we also prefer, we can use other animal also. What happens is that sometimes the horse proteins, if it comes into the preparation, if it is not properly purified, these horse proteins can sensitize the individuals. So some people, even a trace amount of horse proteins can cause us an anaphylactic shock. So in these conditions, we prefer other animals such as the goat. So goat has been ability to provide the diphtheria antitoxin also. So after the selection of the animal, the next step is the isolation. So we isolation of the horse in this case. We isolate and keep the horse in a quarantine for 7 days. So during the 7 days, we will observe the animal and we will examine is there any infectious diseases are there. So the most important infectious diseases we have to check is the glanders. So this glander is a disease generally caused by the bacteria that is Actinobacillus malae. So it is a zoonotic infectious disease, can be transmitted from the horse to the humans. From humans it is quite fateful in nature. If the patient is not treated properly, then the death can occur. So it should be examined properly for the presence of these glanders. So it is a simple diagnostic test. We can do it similar to like of a test for the TB. Generally we do the tuberculin test. So similarly we will do the test with the reagent called the malin. So once we find that the animal is free from these glanders, then we immunize with the tetanus. So generally the horse are highly susceptible to this tetanus, so we are administered with tetanus toxoid so that it can produce an enough quantity of antibodies against this tetanus. So after this, the next steps comes, we need the production of the antitoxin. So we have to immunize the horse. So immunization is nothing but a process in which we administer the toxoid or the toxin into the animal so that it has an ability to produce the antibodies. So in this case we administer the diphtheria toxoid into the neck muscles gradually in a step by step manner in a increasing order of dose for quite a few days as a course up to a few months in a gradual increasing dose. So if you see that generally the first dose is generally about 5 ml in nature, and the next dose after the collection of blood are 2 to 3 times, then we generally increase slowly until the end of the course. If you see that we might have administered up to 600 ml of this diphtheria toxoid. So we increase this dose because the animal should produce enough quantity of the antitoxin titer. So generally this enough we get at the end of the course. So after immunization, the horse will start producing the antibodies against it. So we need these antibodies, that is, it is collected as an antitoxin. So the next step is the collection of the blood. So generally 8 liters of blood can be collected from this horse at a time. So it is withdrawn aseptically from the jugular vein into a bottle, and the bottle generally contains the anticoagulants. So the anticoagulants makes the blood into the same condition. Later on, this bleeding is repeated twice after 8 days interval. So if you withdraw the blood today, means you leave a gap for 8 days, then you can do a second bleeding process, and the animal is allowed to rest for next 10 days. So meanwhile the 10 days the animal can recover itself to produce enough blood. Then the second course we can start it with another shot of antigen, that is another shot of diphtheria toxoid. Then we can further take the bleeding for thrice, and we can repeat this process until the enough antibody titer level is maintained. Generally it takes 4 to 5 courses. So the course is continued for 4 to 5 until it stops producing a necessary antitoxin titer level. So after collecting this blood, the next step is we are processing the blood. So how we are processing the blood, if you see, is the blood is stored in the refrigerator. So during this storage, what happened is the red blood cells started settling down. I already told the horse is preferred because the rate of settling of RBC is faster enough when compared to other species. So it settles faster. Then the supernatant serum is siphoned away. Then it is put into a bottle in which the calcium chloride is added. So the calcium chloride will initiate the clotting process. It is one of the clotting cofactor. So it causes the platelets to get clotted, and the entire clot is removed by the filtration. So we get the pure serum. Then the further process is the refinement of this serum. because the serum contains many proteins. So these are many horse proteins are present in the serum. This protein should be removed. Otherwise, these proteins can cause us problem to the humans, because the horse and the humans are very different species in nature, and so the proteins also very different. So the horse protein can work as an antigen to the human body. So our body has an ability to produce antibody against these horse proteins. So if it is producing, it's well and good, but sometimes what happens is that certain individuals will develop a hypersensitivity state after the administration of this antitoxin. So because of the presence of the trace amount of this horse protein. So generally the two manifestation we can see because of this horse protein is the severe anaphylactic shock and the serum sickness. So out of this, the severe anaphylactic shock is a very dangerous condition. What happens? It occurs immediately after giving the injection of this serum to the patient. So the patient becomes faint and pale, and it and also causes difficulty in breathing. If it is left untreated, the patient can die. So, and this case is generally seen high in the asthmatic patient or the eczema infantile. So the second condition is a little bit mild one, that is the serum sickness. So generally it leads certain headache and a swelling of the face and pains in the joints and fever or rash. So this will be slowly get away once the antigen has been removed from the body, but still the presence of the horse protein is very dangerous to the human. So the serum should be properly refined, then only it can be used for the isolation of the antitoxin. So the next final step is the isolation of the antitoxin. So the serum contains after refinement, it contains three basic proteins. One is the albumin, second is the beta globulin, and third is the gamma globulin. So out of this, the antitoxin is the beta globulin. So we need to isolate beta globulin from this albumin and the gamma globulin. So generally the gamma globulin will have an antibacterial and antiviral antibodies, so it should be removed. We need only the beta globulin. So if you see the method of isolation of this beta globulin from the other two proteins, two methods are generally employed. One is the concentration by fractional precipitation, and second is the concentration by proteolytic digestion. So if you see the first one, that is the fractional precipitation, so this technique is developed with an objective that if you slowly precipitate the other proteins by using a suitable concentration of ammonium sulfate, we can isolate the beta globulin in a purer form. So how it is done? If you see that, first a sufficient amount of 1/3 saturated solution of ammonium sulfate is taken, then it is added to the serum which carries these proteins. So this at this concentration, generally the gamma globulin will get precipitated out, so it is filtered and removed. So now the serum contains only the two constituents, that is the albumin and the beta globulin. So we have to isolate the beta globulin. So the ammonium sulfate concentration is slightly raised from 1/3 level to half the saturation. So at this level, what happens is this beta globulin started getting precipitated out. So the liquid part will carry the albumin. So it is filtered with the help of a filter press. So the liquid portion albumin is get removed away, and we collect the filter cake which generally carries the beta globulin in a purer form. So it is collected and it is packed into a cellophane bag, a dialysis membrane. Then it is kept inside a solution that is chlorinated with a running water. So water runs frequently with a chlorinated, so it goes through the cellophane bag. So the dialysis process will happen. So by this dialysis process, what happened is that the beta globulin is precipitated along with ammonium sulfate. So the ammonium sulfate get dissolved and it passes through the dialysis membrane and it is removed with the running water. Whereas the pure form of this beta globulin will be retained inside the cellophane bag. So this generally takes 2 to 3 days until it is completely free from the ammonium sulfate. So by the presence of the chlorine is that there is no possibility of contamination of bacteria, because chlorine itself acts as an antibacterial agent. It is free from the pyrogen and the other bacteria. So afterwards what happens, we take out the cellophane bag, we will take the beta globulin which is in antitoxin, then its pH is adjusted with the blood plasma, then its isotonicity also kept near to the blood plasma level, that is around 0.9 percentage solution, saline solution. Then a preservative is added and dispensed as in a multi-dose container. So it is free from the pyrogen and other things. This further to ensure it, we can filter it and then we can pack it. So this is one method of we are purifying and getting an isolated form of antitoxin, that is diphtheria antitoxin. And the second method is the concentration by proteolytic digestion. So in this method we will add a proteolytic enzyme. We preferably add a pepsin. So pepsin is an enzyme which generally destroys the protein, just digest the proteins. So to get a maximum activity of pepsin, we have adjusted the pH to 4. So it gives an optimum condition for the pepsin digestion. Then it is incubated at a temperature of about 37 degrees Celsius for 2 days. Here following changes slowly started occurring. The first one is that the albumin is completely destroyed, digested by this pepsin. So it passes through the dialysis membrane. So generally how it is done is that we take a cellophane bag, we fill the serum, then we will kept inside the solution. So what happens is this albumin get digested, it will get removed away. Then the next one is the gamma globulin is partially digested because of the change in the pH. Then it is whereas the beta globulin, what happens is it gets digested but split into two parts. So out of these two parts, one will have an antitoxic activity, that is it has an antitoxin property, the other does not have, but both the things will get retained inside the cellophane bag. It doesn't got passes out through it. So after that what we will do is we will take this one, then we remove the gamma globulin by filtration, then we get a pure form of this beta globulin. So it is further subjected to ultracentrifugation and further dialysis of the product, because there is no traces of albumin and the gamma globulin should be present. So we will add some inorganic salts. So then the entire preparation is concentrated at 55 degrees Celsius along with addition of ammonium sulfate. So this ammonium sulfate, what it will do is it causes the inactive fragments of the beta globulin, which is the another part which if it doesn't need it gets denatured. In presence of inorganic salts, it gets precipitated out. So it is removed, filter off, and the ammonium sulfate, what it does, it forms a precipitate with the active fragment. So we isolate the active fragment in the precipitate of ammonium sulfate. Then it is removed similar to the fractional distillation process, fractional precipitation process, kept in a dialysis bag in a chlorinated water tank. So ammonium sulfate got away, we get the pure form of the beta globulin, that is the active part. So then it is adjusted to isotonicity and preserved in a multi-dose container and it is dispensed. So this is how the production of diphtheria antitoxin is done. So if you see the dosage and administration, diphtheria antitoxin is given in two ways. One as a prophylactic purpose and second is as a treatment purpose. So if it is given as a prophylactic purpose, it is given intramuscularly about 1000 IU. So if it is for treatment purpose, the treatment is based upon the type of infection it has happened. So if it is a pharyngeal or laryngeal diphtheria and occurs about 48 hours of duration, then we have to administer intramuscularly 20,000 to 40,000 IU. If it is nasopharyngeal diphtheria, then about within 48 hours we have to administer about 40,000 to 60,000 IU. If it is an extensive diphtheria which has occurred for about 3 or more days, then we have to administer about 80,000 to 1,20,000 diphtheria antitoxin intramuscularly. So if you see the storage condition, it is generally stored similar to other vaccines 2 to 8 degrees Celsius, that is 36 degree Fahrenheit to 46 degree. So and moreover it should not get freezed away or do not expose to any freezing temperature. It should be maintained properly. So thank you very much for understanding about the diphtheria antitoxin production process. So in my other lectures you can understand the production of the diphtheria toxoid as well as tetanus toxoid. Thank you very much.